Patient Engagement Sorry. Hello and welcome to George and Fahey Center for Healthcare Innovation, CHI's April Patient Engagement Lunchtime Learning Series for the 2025-2026 academic year. My name is Maxa Sawyer, one of the patient engagement consultants on the patient engagement team at CHI, and I will host the session for today. Today's session is entitled Patient Engagement in Nutrition Research, Partnering with Parents and Caregivers of Children Born with Trisomy 21 Living in Manitoba with Maria Baranowski. A few housekeeping details. The PELL series is accredited by the Royal College of Physicians and Surgeons of Canada as a group learning activity. It may also be eligible towards credits towards requirements for other professional bodies. We have auto transcripts enabled, which can be toggled on or off at any time using the captions button at the bottom of your screen. One of the PELL's goals is for the lunchtime learning series to be engaging and interactive. You can use the Q&A throughout, and your questions will provide valuable insight and learning opportunities for both the audience and presenter. The presenter will answer the questions at the end unless they deem it appropriate to answer throughout. The chat is disabled in this webinar, and we are unable to unmute people who are not designated as panelists. Please submit any questions or comments using the Q&A feature located at the bottom of your screen, and I will be presenting them to the speakers when appropriate. This PEL is being recorded. It will be uploaded to CHI's YouTube page. The recording of the PEL alongside an edited version of a PDF of the PowerPoint will be emailed as soon as it is available. I would like to take a moment to acknowledge that we are gathered on the ancestral and current day lands and waters of the Anishinaabeg, Innuwak, Unshinawak, Dakota Oyote, Denisulene, and on the national homeland of the Red River Métis. In northern Manitoba, we acknowledge the ancestral lands of the Inuit and gratefully acknowledge that our water is sourced from Shoal Lake 40 First Nation. We respect the treaties that were made on these lands, we acknowledge the harms and mistakes of the past and present, and we dedicate ourselves to move forward in partnership with Indigenous communities in a spirit of reconciliation and collaboration. And our hope is that by asking questions and asking how we ask these questions, what questions are asked, when, to whom, why, we are furthering this work of creating space for voices that have traditionally been silenced. Now to welcome the speaker, Maria Baranowski. Maria has recently completed her PhD, congratulations, in the Interdisciplinary Studies program at the University of Manitoba, under the supervision of Dr. Shaheen Shushtari. She is also a dietitian in private practice, a researcher at St. Amant Research Center, and a parent advocate for inclusion. Maria is a mom to 3 sons, the youngest of whom was born with trisomy 21. Welcome, Maria.
Thank you very much, Maxa, for that introduction, and thank you for inviting me to speak today. My research project aimed to determine the nutritional related health of children with trisomy 21 living in Manitoba, as well as to explore their experiences receiving nutrition knowledge and care. Today, I will share with you my experience consulting with parent engagement research partners to inform several aspects of my PhD project. There will be time for questions and discussion at the end. I've also included a few questions throughout the presentation with the intention of making our time together a little bit more interactive, although I'm not sure if that will work if the chat is disabled, so you can let us know at those points of questions, Maxa, if that's going to work. And I just want to thank everybody in advance for their participation, and thank you again for taking the time in your lunch to be here today. Today's learning objectives are to identify factors that positively impacted the process of meeting with parent and caregiver engagement research partners and the future project to examine barriers to this process and talk about how they might be improved in future projects, and to understand how meeting with parent and caregiver engagement research partners was integral to the success of my project. Before we before we begin, as Maxa mentioned, I wanted to disclose that I do share lived experience with the parent and caregiver engagement research partners I consulted with, as I am also the parent of a child with trisomy 21. My youngest son, Nick, was diagnosed when he was 3 days old, and he's pictured here at his brother's baseball game. My older sons, Jack and Luke, are pictured on my parents' farm in rural Manitoba. Nick received services related to his diagnosis from multiple healthcare providers in Winnipeg until he was 9 years old. Then we moved back to my hometown last year, so Nick received services from a smaller number of different healthcare providers that are available in a small town in Manitoba. As an insider researcher to my project, my approach to generating interest in and creating a project about trisomy 21, nutrition, and lived experience with related care is informed by these shared details about myself. However, I acknowledge that I'm only the expert of my own personal experiences. I know that other parents and caregivers of children with trisomy 21 living in Manitoba have different experiences and have different perspectives. I wanted to design a research study that would be meaningful to others, so it was important for me to meet other parents and caregivers and to learn from them. Now that you know a little bit about who I am curious to know who's on the other side of my screen today. Is it possible for attendants to share where they're logging in from or what they do using the chat box, Maxa, or has that been disabled
They can write in the Q&A.
in the Q&A? All right.
So if people want to write in the Q&A what their positionality are, who they are, it would be very helpful. We have people saying that the Winnipeg CHI staff, a retired social science researcher from Treaty 1, a patient engagement specialist at the Children's Hospital Research Institute in Winnipeg, a research coordinator at the Chronic Disease Innovation Center. Thank you to everyone who's participated.
Yes, thanks for sharing a little bit about where you're at or what one of your roles might be. Thank you. The Canadian Institutes of Health Research defines patient engagement in research as the meaningful involvement and active collaboration of individuals with personal lived experience of a particular interest in its governance, priority setting, research, and knowledge translation. Patient engagement researchers are considered partners in the research process and are allowed to contribute to research-related activities in a variety of roles. Indeed, their perspective is intended to be integrated into every step of the research process. This may mean that patients help develop research questions, define research objectives, collect data, or evaluate results. Ultimately, the patient engagement researcher's role will vary depending on the individual skill set of the person and how they wish to contribute to the research team. And while it may not always be possible to engage with patients throughout the entire research process, whenever their meaningful collaboration or consultation is feasible, these opportunities are meant to be prioritized. So I'm going to pose another question. When you hear the word patients, what comes to mind?
Again, we invite you to write that in the Q&A, and I will read them out loud as they come. Oh, we have more people saying that they are researchers at CHI, manager in quality patient safety at St. Boniface. um, and someone who is working as an RA in shared health and worked with Maria in this role. So, what do you think of a patient is the person who is ailing and supporting their loved ones? Oh, sorry, a person who is ailing and they're supporting loved ones is one answer about the term patient.
Any other?
Sometimes it takes a second for it to come up. Oh, we have a lot more exclusively related to medical care, health sciences, but the field of PE is so much broader. The term patient brings to mind being ill, requires treatment, a person who needs support by family and HCPs, healthcare professionals, partners in care.
Awesome. Thanks again, everyone, for sharing your thoughts. In the context of patient engagement in research, the term patients is meant to refer to individuals with personal lived experience of a particular research interest. So it may not be the best term, and not everyone cares for its usage in this context because it might have mixed meanings and mixed understandings for different people. Personally, for my project, I preferred to use and refer to the people I consulted with as parent or caregiver engagement research partners. So, what facilitates this process? Again, before I pull up some or offer some ideas, I'm again going to ask the audience, does anyone have any experience with patient engagement in research and or any ideas about what might facilitate the process of working with those who have lived experience?
Thank you to everyone who has participated so far. We're really enjoying your participation in the Q&A, and I know it takes a minute to come up. Building trust and relationships. Working on accessibility of them, non-judgmental approaches. I will answer those live so that you can see what people are saying, not just here. Non-judgmental approaches, recognition of power differentials, communication and transparency, building trust, showing empathy while building relationships, being part of the community that will be researched, partners in care, oops, institutional support, pathways for compensation.
Awesome. These are great. This is a great list. It's a great list of potential facilitators of engaging in patient engagement and research. And thanks again for your participation in answering that question. Some facilitators identified by CIHR include that key players understand and believe in its value, mutually respect one another, and have a shared sense of purpose. It might be noted that respect and trust usually go hand in hand and take time to earn. So, investing enough time to creating genuine rapport that fosters sincere feelings of trust and respect may be an important first step. Certainly, safe and culturally competent environments facilitate feelings of comfort. It is also essential that lived experience is valued as evidence and that diverse patient perspectives are acknowledged. So, when ideas or opinions are being sought from others, it is important to demonstrate that their feedback is, in fact, being meaningfully considered and incorporated. So, given the list of facilitators, as you may expect, potential barriers to patient engagement in research may be a lack of mutual respect or understanding and perceived value, a lack of shared sense of purpose, unsafe environments, and dismissive attitudes towards lived experience or diverse perspectives. Can you think of any others?
In the Q&A box, I will read them live.
Thank you, Maxa.
Barriers to patient engagement in research. Uh, all of them, someone wrote.
Commitment of resources required to build trust and respect, understanding and purpose may also be a barrier. So, essentially, time and money. Recruitment of patient engagement researchers can also be a barrier. And it is important to note that currently there is a lack of standardized language about patient engagement in research, as well as standardized methods for and regular reporting of evaluation of its impact. So this is a list of some potential barriers to conducting patient engagement in research.
Maria, you've provided such a good background on what patient engagement is. Can you tell me how your PhD research, a little bit about your PhD research project that looked at the nutritional status and services of children born with trisomy 21 living in Manitoba? What sparked your interest in using patient engagement, which you renamed parent and caregiver engagement for the project? And how did parent and caregiver engagement shape the project?
Thank you for that question. What sparked my interest was essentially me acknowledging my own biases and limitations as an insider researcher approaching this project, meaning that although I had a professional and personal background that informed my interest and path to creating a research project of this nature, I was just one person with this particular experience. And I wanted to ensure that my research project would be meaningful, that the findings would be meaningful to others. And in order to ensure that, it was important for me that I was consulting with people who were not me, but
Hmm.
shared a similar lived experience so that I would not miss out on some factors or some perspectives or some nuances that might be important to consider. So I wanted my project to be a research study that parents and caregivers of children with trisomy 21 living in Manitoba would want to participate in. And I also wanted it to be a project that would produce findings that
Hmm.
people would learn about and feel were meaningful to increasing their own knowledge or improving their own practice or inspiring future research to have a meaningful impact.
So I find it so interesting that you recognize your own positionality and how, although you have the experience as a person with lived experience, you know that that experience can also create bias or perhaps um, a limited reach in how your research could be presented to the public, or maybe your interest isn't everyone else's research. So, how did parent and caregiver engagement shape the project?
Yes, absolutely. Now, I will just note too, my project was part of my PhD program, which, as you had mentioned in my introduction, was in interdisciplinary studies.
Mhm.
And so prior to that, I was trained exclusively in human nutritional sciences. And so this was my first foray, if I may use that word, into what could also be considered disability research. And so
Mm,
it was also a way of acknowledging my limitations in fully understanding what that looked like, particularly as it overlapped with nutrition research.
mhm,
But certainly, yes, I can share with you that essentially I met with my parent engagement research partners. So they all ended up being parents of children with trisomy 21. And the ages of their children ranged from infancy to young adulthood. And I met with them three different times. And each time we met, it was for a different purpose. There were different goals for each of these meetings. But definitely the outcome of each of these meetings directly impacted my research project. And this is just a summary slide of how so. So the first time I met with my parent engagement research partners, their feedback informed the list of potential nutrition related factors that I included to consider and ask about in my research study that might impact a child with trisomy 21's nutrition related health. The second time I met with parent engagement research partners, I requested their feedback for different data collection, different dietary data collection tools,
mhm.
as well as their ideas for how to recruit a larger and more diverse and more representative study sample within the province of Manitoba. And the final and third time I met with my parent engagement research partners, I was really asking them to review my work, my data interpretation of the data that had been collected with study participants, and then after that data was analyzed and how I interpreted that, if it was actually if it aligned with the data they shared with me, or if they had any saw any inconsistencies or had any concerns, or if they just had a different understanding of what that meant or an enhanced understanding of what that meant. And so that particular activity enhanced my data interpretation. It enhanced my ability to discern and discuss the study findings. And it also included, we talked about how to best create knowledge translation products and knowledge mobilization plans. So again, a conversation about how best to disseminate the study findings as widely as possible in as many different formats as possible to as many different kinds of people as possible so that the results would be widely shared.
So you did patient engagement throughout your project.
Correct.
Amazing. Yeah, that is something that we sometimes find difficult. So often we think knowledge translation is where our patient engagement can come in because that's perhaps
Mhm.
the obvious, and maybe we don't think that they can inform what type of questions you should ask. Were you surprised by some of the questions that they came up with?
I was actually, each time I met with my patient engagement research partners, I considered it a privilege and I learned from them. I can recall vividly those learning moments. So the first time I met with them, it was to find out, if my research objectives and questions kind of aligned with what other parents and caregivers with the shared lived experience would also deem as being important and worthy of investigation. But I also wanted to create a comprehensive list of individual and external level factors that may impact a child's nutrition related health. And these parents shared with me their thoughts and ideas about what they think impacted their child's nutrition related health. And so certainly parents and caregivers who had more experience in their role than myself, for example, were able to share different factors that might have impacted their own child at different parts of their lifespan. So I remember puberty and the potential impact of puberty on nutrition related health coming up as one potential factor that I had not considered. My study was primarily aimed at children between the ages of 6 and 12. And so I had not included or considered puberty to be a potentially influencing factor. And as I learned from another parent, that this very well could be even within that age range. And so, based on their feedback and based on their experience, I did add that factor into a list of the questions that I included in my survey instrument. The second time I met with parents, one of the things we also talked about, as I mentioned, was different dietary data collection tools. And so I gave just a brief overview of three or four of the more common types that are used in nutrition research and some of the advantages or disadvantages about each one. And then I asked the parent engagement research partners, what do you think about these different dietary data collection tools? If someone was asking you to be in a nutrition research project, and to collect or record data about your child's food and beverage consumption, would any of these, which one of these would you be most likely to want to complete or want
Mhm.
to do? And also, which one do you think would be most accurate of your child's actual intake? So that was revealing to me. I would have assumed that parents would have opted for the least invasive and also the least time consuming activity, but I still remember the parent who quite frankly shared that they were so used to being asked and
Mhm.
interrogated with so many questions by so many healthcare professionals on behalf of their child about so many different systems and things about their child that they didn't actually find any dietary data collection tool would be over and above what they already do anyways. And so,
Mhm.
yeah, that was revealing to me and also gave me more insight as to the types of people I would be working with in my research project, the types of people I would be recruiting, and what they were bringing already to that project. So, this maybe more than average amount of exposure to being
Mhm.
in these situations where you're essentially being interviewed about your child um, for the purposes of improving health. And then finally, when it came to the last meeting with parent engagement research partners, one of the things I had asked about was if they had any ideas about knowledge translation and how best to communicate key findings, particularly to other parents and caregivers. And it was noted, and I did incorporate their feedback that it wouldn't be enough to share the finding, for example, that all children included in this study consumed excessive amounts of dietary of sodium based on their food and beverage consumption. They suggested, in addition to sharing that finding, to also offer a recommendation about how to decrease the amount of sodium in their child's diet based on food and beverage consumption patterns. Same thing with the finding about no child in this particular study consuming adequate amounts of vitamin D. The parent advised. So, when sharing that finding, particularly to parents and caregivers and others who are responsible for feeding these children, to also share then what are good sources of dietary
Mhm.
vitamin D and how to incorporate those sources into a child's diet in order for the findings to be more meaningful to parents and to caregivers.
So they guided you towards a more strength-based approach that will give them practical
That's right.
tools so
Yes,
that
they wanted practical advice as to so here are your findings. Now
mm,
what?
now what? Yeah,
What do I do with that, right? What do I do with that if I don't know what foods and beverages are good or poor sources of vitamin D or calcium or fiber or sodium or et cetera, as related to the study findings.
right. Um, you've talked a little bit about your position as a nutritionist, mother, and child with trisomy 21, and researcher, I should add, coming from and going back to a small town in Manitoba. Can you tell me a little bit about how that affected your recruitment engagement approach and how you built that safe space?
Yeah, absolutely. At the beginning, as part of all of my meetings with parent engagement research partners, regardless of what the goal was for that particular meeting, we always started off with introductions. Um, and everyone had a turn to speak and introduce themselves if they wanted to, in
Mm-hmm.
however way they wanted to. So whether that was with a video, without a video, whether that was using the chat box, whether that was talking about who they are, where they live, what they do, or some other way that they feel comfortable introducing themselves. Um, and so everyone had this opportunity to speak a little bit about who they were, why they were interested in joining this conversation. And we all had a turn to talk, we all had a turn to listen. And I think that provided an opportunity to see where we shared maybe some common ground. So we all knew we were part of this particular project or this particular activity because we shared lived experience parenting a child or caregiving a child with trisomy 21. However, there are other ways in which we may have also had similar experiences. So whether I'm disclosing that I'm from a small town in Manitoba or that I lived in Winnipeg for a very long time, that might have connected with somebody to share about their small town upbringing or their city living. Or if I disclose I'm a parent of multiple children or a dietitian or researcher, and other people might share different elements about themselves. It just helped to build some rapport where we were having almost like a natural conversation about, even though we had not known each other or met each other beforehand, just at more natural ease to starting the whole process, like before diving
Mm-hmm.
into what were the targeted questions of that particular initiative meeting. Before we got to that point, just chatting with one another, getting to know one another, and allowing time and space to do that versus being too formal too quickly right off the bat.
Mm-hmm.
Um, I feel like that really helped open the lines of communication where everyone felt really comfortable speaking to everyone else and feeling it was a safe space to know that like what you were being said wasn't being recorded, it wasn't being published, it wasn't being judged, there was no critique in it.
Mm-hmm.
And yeah, I think that really facilitated the like a building a trusting relationship within
How,
each group.
oh, sorry, go ahead.
No, that's okay. I'm done.
How did you find the people to come into your patient engagement process?
I recruited them primarily through membership at Manitoba Down Syndrome Society at that particular point. And we did talk about, the limitations of that. Like as a group, we talked about that. So we're all here because we got the email invitation through our membership of this provincial advocacy organization. And even though it is provincial wide, um,
Mm-hmm.
largely membership is Winnipeg based or urban centered based. And so that was one of our discussions as a group, as research partners, talking about, particularly when we talked about how to recruit a more representative or diverse study sample within Manitoba. We talked about, who's missing from the group that's meeting right now, and how do we get in touch with those folks? Um, it's easy to go to a central organization like the Manitoba Down Syndrome Society because it kind of gets you started
Mm-hmm.
with connecting with people. But I will say that certainly for the research project itself, when it came to recruiting study participants, a lot of the success was actually through word of mouth. And so you might have your first step might be connecting with a particular organization, but once one parent or caregiver finds out, as long as they're willing to share information, sometimes you can kind of get a larger recruitment happening almost naturally, just by word of mouth, like a snowball effect, essentially. But yes, for these initiatives at this point, it was primarily through, yes, the Manitoba Down Syndrome Society membership list. So that was the organization that assisted with recruitment for patient engagement.
Did you have previous relationships with any of the people who you were doing patient engagement with?
Um, that's a great question. So definitely like the third activity was
Hmm.
already with people who had been study participants. So
Hmm.
at that time, for sure, people knew one another and I was familiar with them. But for the first and second, there might have been one person I had recognized because we do all come from a relatively small community of parents and caregivers of children with trisomy 21. This isn't a large group in Manitoba, with or without your association or membership with the Manitoba Down Syndrome Society. But largely no, I didn't know most of them. Maybe one I had recognized. So that
Hmm.
was neat too, because it certainly then broadened um, my contact list and what's been really, again, just because I'm part of this community and I live in the geographical area that I studied, um, since then, I have seen people, whether it's been at a mall, whether it's been at a different virtual event that we're participating in as, parent and caregivers of children with disabilities. And so that's been really neat. Um, and I think that's one of the things when I reflect about this experience that I would maybe if I was to redo it, I would try to incorporate some aspect of how to continue
Mm.
as like these relationships or opportunities to connect with one another, this sense of community.
Right.
Because it has happened for me with a few people naturally, unexpectedly, and not planned. But that in hindsight, that would have been something I think that would have been nice to consider and maybe important to consider. So even past the point of disseminating study findings, then what? Is there a way in which you can stay connected and would that help foster feelings of being of community and still being a part of one another's lives in some way?
Right. Like maybe a WhatsApp group or a Facebook group or
Yeah,
a
something like that.
1 year reunion. Um,
Yeah.
how did patient, parent, caregiver engagement, how will it influence your future research projects?
Um, Again, great question. I think there are, as I had mentioned, there were lots of things that I would do differently. So when I reflect about my experience, I think I would expand my recruitment efforts to try to get a more diverse representation of parents and caregivers. So that would be one thing that I would think that I could change or that I could improve upon. So versus relying primarily on, let's say, Manitoba Down Syndrome Society to
Mm.
recruit people. Also, everything I did was virtual, and that was because I wanted to be able to reach different parts of Manitoba. And I do think I was successful in doing that because I did meet with people who came from different city centers or different small towns within the province. And that would not have been that would not have been possible had I only been in one site, been just in my small town or been just in Winnipeg at the time that I was still living in Winnipeg. But maybe doing both. So maybe having some in-person opportunities and as well as some virtual opportunities to meet with other people that might have enhanced the diversity of the group that I was meeting with. Alternatively, I would also maybe consider doing things differently in how people can share feedback. So,
Mm.
um, not everybody is a fan of logging into a Zoom meeting with or without video. And so maybe offering a chance to share feedback about some key questions or key topics via email, via text, whatever kind of works best for others. And as I mentioned, I do think staying connected afterwards somehow. I haven't figured out exactly, but for someone like me who's passionate about this particular overlap in trisomy
Hmm.
21 and nutrition, this project uh, is more than just one project for me. Like I have an inherent interest in staying connected to this community, and realistically, I am part of this community
Hmm.
for as long as I live. So it having some sort of established way of following up with one another, staying connected to one another, and building that community would be another idea moving forward.
Did coming in as a researcher other you as a parent?
Um, I think it could have. I do think that sharing my positionality, and when I do, I pretty much start with the fact that, I'm the mom to three boys. And like, I think the way in which we introduce ourselves and share our origin stories tells a lot about what our values and priorities are. And I do encourage people who want to connect with others for the purposes of patient engagement and research to be thoughtful about, yes, those sorts of things, how we introduce ourselves and how we share our origin stories. I've been really inspired more recently as I continue to learn about different Indigenous teachings. So, as an example, I recently attended a storytelling and evaluation and research webinar, and the
Mm.
speakers were encouraging or challenging the audience to really know your origin story and to feel comfortable sharing it. And I have to say, it is a bit of a difference. So when I put on exclusively my researcher hat, I don't necessarily feel always that it is welcomed or encouraged to disclose personal information about myself. However, patient engagement and research is a perfect example of where sharing a bit about yourself can actually be quite disarming and quite inducive to not being othered because
Mm.
of the other roles you might have. And so, to be quite honest, even though the reason we were meeting as a group was for research related purposes, when we were doing our introductions and getting to know one another, we essentially just talked as though exactly who we were, parents of children, stop. And then maybe another added layer, parents of children with trisomy 21. So if you can find ways, I think, to connect with who you're meeting with just on a really personal and human level, I
Mm.
think it does spare you from being othered by any other potential rules you have. I even worried about the dietitian hat because sometimes that can come across as being potentially judgmental, potentially critical, particularly if the topic is related to food and
Food.
yeah. And so, 20 years as a dietitian has taught me that like
Right.
you need to be also disarming and thoughtful about how you approach that because for some, automatically the
Hmm.
perception will be that you're, analyzing or, criticizing what they're disclosing as being their food and beverage choices as an example. So I try to be mindful of that. So no, I didn't feel othered as a researcher, but I think it was because the way in which I introduced myself and really um, focused on like I'm here first because I'm a
Hmm.
parent who shares this experience that you also have, and I just want to learn more about this topic. I am also a researcher, but I don't know everything. Like I know just my one son with this diagnosis, and you all have other experiences, and so also acknowledging that right up front that I'm here to learn. And I think if you can, I think if you mean that, and if it
Hmm.
comes across sincerely, then no, I think it just reduces your risk of being othered by any other role you might have. But that's a
Right.
great question, and thanks for sharing that.
Well, we're getting to the Q&A portion of the talk. While we wait for some questions to come in, because we know there's a little bit of a lag between people typing and us receiving it. I'd like to share that one of the ways that we met Maria Baranowski is because she was a Prep Award winner.
Hmm.
And we will be launching the Prep Awards soon. It allows the winners to have some money to be able to invest in their patient engagement and do their patient engagement properly. We will be sending out emails when we are ready to launch. But we encourage if you are considering doing patient engagement in your own project to look out for the email and to share it with anybody who may be interested. Maria,
Yeah,
you said that you had some experience applying for this prep award.
yeah, I think I applied a couple of times and was lucky to be successful and to receive, yes, some financial support to conduct these initiatives with my parent engagement research partners. And it was excellent in that of some of the facilitators to conducting patient engagement and research for my project, one of the big ones was access. And I had mentioned that I did conduct the meetings virtually, and I was asking the engagement research partners, what times would be most available to you, what would work best for you. I was trying to be as flexible as possible because I knew I was meeting with people who had demanding demanding lives and great responsibilities and wouldn't necessarily follow a typical 9 to 5 schedule. Uh,
Mm-hmm.
but definitely the award allowed me the opportunity to also offer internet or childcare services in case that would be a potential limitation to a parent or a caregiver from meeting with me or participating with me. I know, again, I even just know from my own personal experience, sometimes there's a great thing I'd like to participate in, but if childcare doesn't come with it or the compensation to arrange childcare, then I just simply can't. So I do think that was whether or not people request that kind of support, the fact that you're able to offer that is definitely helpful. And I think incentivizes people to participate in the process. So yes, very grateful and acknowledge the prep award that I received to provide honorariums to parent and caregiver research partners for just to say thank you for your time and thank you for sharing your feedback and thank you for thinking it was important to participate. It just demonstrates respect and value too of their time.
Thank you for sharing that. Any questions from the audience? As someone who has also lived experience in an area of research I undertake, I often wonder about the times when lived experience input may come in conflict with
Mm.
existing best evidence and how to navigate those situations.
I concur. I have that experience often, I think. Um, I think, and thank you for that question, and thank you for
Oh,
asking.
sorry,
Yeah, I said,
yeah,
uh,
okay.
yeah, I have experienced that. I think as a dietitian or a dietitian researcher, and now with this extra layer of dietitian researcher in disability field. Um, but even just starting with just the dietitian hat, there's often times when I come across information that I know isn't following best practice. And exactly how do you navigate that? And so I guess there's different ways that we're trained to provide information as people seem ready to receive it and to ask permission to do the same, making sure that um, if I'm providing a resource or if I'm providing advice or if it's welcomed, it's wanted. And so yeah, sometimes that means timing matters a lot and waiting for that opportunity or asking for permission to providing that kind of information um, might be a good first step. Knowing your audience, knowing who you're
Mm,
talking to, I think can also just help guide you in situations like that. Certainly, if I feel I have a closer relationship with someone, I might be able to be more forthright. Whereas
mm,
if it's just a beginning of a relationship, I might need to practice patience or practice silence or demonstrate curiosity or learn more about um, maybe why things are the way they are for a particular individual, and maybe it is due to external factors that are beyond their control, and how I can find then some understanding in that, and how I can um, help support or facilitate whatever they need at that time. So just acknowledging my own limitation that I can't always necessarily, it's not my agenda. It's
mhm,
not it's that and that isn't actually in my best practice or ethical standards either to tell somebody else what to do. It's to know what it's to listen to what they're telling me they need or they want to know, and what they're hoping to do different. Um, when I was doing the interviews as part of my research project, and also even after I would meet with the parent engagement research partners, one of the things I've learned from conducting qualitative research in general is this practice of writing a reflexive memo afterwards. And
mhm.
so I think I am the type of person that maybe naturally does this even before I knew it had a name or was a thing that qualitative researchers did. But this idea of reflecting afterwards as a way of potentially identifying and mitigating your own biases that you might bring to that conversation or to that experience, or how you
Mm,
even perceive the information as it's being shared with you. I have actually felt that to be quite helpful in helping me navigate situations as you've asked about and as you've described.
mhm.
Sometimes that can kind of help guide me. Am I maybe overreacting or hypersensitive or not? And
Right.
why that might be and what I can do about it, or what I might need to learn or think about or ask a colleague about, or again, knowing your own limitations and being okay with that, and still being eager to say, okay, I might need help navigating that situation, and is there someone that I could ask about how to do that if I truly feel at a loss. But sometimes even just that process of writing a reflexive memo has been really revealing to me and has been really helpful, and it might work for others.
'Cause I could imagine existing best evidence and lived realities
Yeah.
um, often do not go hand in hand. And
Yes.
like whose practice it who is not doing best practice? When do doctors care? When do doctors not care? When do dietitians care? When do dietitians not care? Can be quite biased when these parents are coming to practitioners.
Right. And I think, well, both from my trained experience as well as my personal experience, the way in which we feel we are being perceived by somebody else can dramatically change how we feel about continuing the conversation or how we're going to answer the next question. And so just always being mindful of that. Um, Certainly, if I feel I am receiving a very narrow-minded question, I'm
Mm,
probably not going to feel super open about providing an honest answer. And so when when the tables are turned and now I'm in the position of asking a question, I really try to keep top of mind, um, whether it's the tone in which I say it, how I say it, the words I use to say it, just as much to be as non-judgmental as possible.
Hmm. Maria, I if I were to take away one thing from your presentation, I mean, there's so many things that I could take away, but one of the things that I'm really feeling in this presentation was uh, patient, caregiver parent engagement practice that centered in humility.
Absolutely.
And you really showed us such a wonderful ways to practically practice humility, not just say we are practicing humility, but this is what I did, and this is what was successful, and this was what I could do better. So I thank you so much for teaching us at, how you practiced your parent and caregiver engagement. I thank you for your honesty, for the practical tools that you shared with us. And I also would like to thank our guests for participating and for answering our questions, for asking questions. We really appreciate you
Yes.
taking your lunchtime hour to be with us. On a practical note, you will receive a follow-up email with further information on how to access the slides and recordings. We also welcome your feedback for this PELL patient engagement lunchtime learning. When you close this session, you will be asked to complete a short survey, and taking a minute to answer that short survey is really helpful for how we can build our next year's program. We would also like to invite you to join us for May's PEL called Evaluating Patient and Public Engagement in Health Research and Health Systems with Ashley Struthers, Manager and Research Association in Evaluation and Quality Improvement, and Carolyn Shimon, Patient and Public Engagement Lead, who both work at the George and Fahey Center for Healthcare Innovation. Evaluation is critical to understanding the impact of engagement, ensuring accountability, and driving improvement. This session introduces practical approaches to evaluate patient and public engagement in both research and health system contexts. Participants will learn how to choose meaningful measures, combine qualitative and quantitative methods, and use evaluation results to strengthen engagement practices. Thank you again to Maria. Thank you to our audience, and we hope that you walk away encouraged to further explore the possibilities of patient engagement in your work.